Good evening, Namaskar. I, Kriti Vadhera, would like to welcome all the viewers to SAHYOG session of NCERT. Yes, SAHYOG, the special guidance and counseling session where we discuss about mental health and well-being of our children and adolescents. And today, the topic which we are going to take, I think, globally, who all viewers are watching us live can connect to this, as we are going to discuss about the taking care of mental health of our children in this pandemic situation. Yes, and to discuss this topic, the experts who have joined us, I would like to introduce Professor Subhash Chandra Roy, who is joining us from RI Northeast. Namaskar, Professor Roy. We welcome you to Kishore Manch.
Namaskar.
And the practicing counselor who has joined us for this discussion, I would like to introduce Dr. Lopamudra Saha. She is joining from Agartala. Dr. Saha, we welcome you to Kishore Manch.
Good afternoon, everybody.
And before we just start with this today's discussion, I would like to tell the viewers that during this discussion, you can ask questions to our experts. Feel free to dial on our toll-free numbers. Our numbers are 1800111265 and the other number would be 1800112199. And you can also send your queries via email. Our email address is cit.kishoremanch@gmail.com. And to watch the live streaming of this program, kindly log into our official YouTube channel, NCERT Official. And there also in the live chat box, you can comment and ask questions to our experts. So starting with today's discussion, I would like to bring Dr. Roy into the conversation. Sir, I would like to ask you what we should understand by this mental health of our children. Can you please elaborate about this mental health?
Thank you. Mental health is a state of mind. It's a state of the emotional status of an individual, the psychological status of an individual, as well as the social well-being. It is well defined by WHO and many scholars. I mean, it talks about the emotional status, the feelings, the psychological aspects, the thinking aspect, as well as the decision-making aspect, the response aspect, the social adjustment aspect. When we talk of mental health, it is related to how we think, how we feel, and how we act, how we respond to others. So, mental health is very important to handle the stress, the trauma, the day-to-day pressures of life. It also relates to others. When we respond to others or we try to adjust with others, I mean, the mental health is one of the determinants. And at the same time, I would say that it's mental health which helps you to take major decisions or appropriate decisions in life. So it helps you in taking decisions also. Mental health is very important for one to feel good, to have good relationship in the world, to have good quality of life, to make good choices every day, and to enjoy life, to feel good about oneself. So mental health is, I think, it is the basic requirement of a quality of life.
Absolutely. So that was about mental health. And bringing into the conversation, I would like to bring into the conversation Dr. Lopamudra Saha, who has joined us. Dr. Saha, is it really necessary to keep a check on good mental health of our children? Can you please guide us on that?
Yeah, obviously, mental health is very much important.
Okay.
For the children. Before talking about mental health, let's have a look like how this we know about this the effect of COVID-19. We had lockdown for so much time. The children are not going to the schools for so much time, and due to this, what has happened that we have our physical movement out of the home has been restricted. The social we have to maintain a social distancing whenever we are outside the home. We have to wear mask. We have to go for proper hygiene, and we are our restricted availability of most public services. So this has affected the daily routine drastically, and this has called upon the mental health of the children as well. According to psychologists, delay in getting children and adolescents back to school is putting their mental health at risk. Disturbance in the mental health not only have negative impact to a particular child, but also have serious negative impacts on the community itself, because the children are within the community and they are the future of our nation, right? The entire performance of the students also depends on his or her mental health. In this scenario, maintaining a good mental health has become a necessity, especially for the children. As the schools are closed, they cannot go out for play because of the fear of contamination. Then they have loads of time in home, but they have less work to engage with. That is very annoying for the children. They don't know how to spend their time. They don't know like what to do, what fruitful have to do. They have so much of time. They are tired of playing also now. Schools are not there.
Right, absolutely. That is what we are facing these days inside home. Yes.
So it has become quite now, though online classes have started. Still, the parents are like they are actually thinking what to do, how to engage the children, how to actually manage them. It has become quite tough for the parents also to manage. So in this scenario, the children, this effect of the adults also, the emotional, this emotionally affect the child also. In this way, it has become a very problematic situation. So it's very hard to actually maintain the mental health of the children.
Yes, absolutely. And as you said that it's all about parents, as we are living in this pandemic era and students are captured in houses during this lockdown period. Dr. Roy, here I would like to ask you, can you please tell us what is the role of parents in maintaining this good mental health of children?
Well, parenting is really a very, very important task. Parents, to a large extent, in my opinion, they decide the mental health of their children. How parents respond to their children at home, how they behave with them, how they accept their children, how they perceive their children's behavior at home, I think that is one area which determine the mental health of the child. At the same time, I would say that the environment there at home, which is created by parents, both wife, husband, and other members of the family, that environment also has a lot of effect on the child's mental health. If the environment is not enabling, if it is not caring, if it is not loving, if it is not accepting, I think it will have a negative impact on children's mental health. At the same time, we find these days there is a relationship problem in the family. Wife and husband, they often quarrel among themselves. The father gets addicted to many things, the alcoholism and drug addiction and other things. Other bad habits are there in the family. So there could be n number of issues which make the family environment very problematic and tense for the child, and it leaves a very negative impact on the child's mental health. I would say at this point that children they interact with their peers, they go to schools, they go to their neighborhood, in the family also siblings are there. So I mean they have a lot of pressures also, sibling pressures, peer pressures, bullying in the school and outside the family. So they return back with lot of anxieties, lot of tensions, lot of trauma, and it is the family, it is the environment of the family, it is the parents
Right.
who prove to be the shock absorber. So
Absolutely.
how they accept them, how they perceive their behavior, how they treat with them, I think that creates a very positive self-image in children, and that is one of the determinants for good mental health.
Absolutely, I agree to the fact that whatever is being held inside the home, children are perceiving it. Dr. Saha, if I ask you that, is there a role of teachers these days in good and mental well-being of our children? Can you please guide us on that?
Obviously teachers have a role, because like, as you know, as a professional, I'm also
Right.
a teacher, so I know that I have to go through online classes. I have to actually spend, it is like we have to engage more with the children nowadays.
Right.
And yes, because children spend a lion's share of their time with their teachers, so there is a lot of role of the teachers to actually to play.
Okay.
In this connection, I can say that teachers can go for hope. See, I can tell that you can encourage helping others, and most importantly one's own self. We say
Okay.
that charity begins from home, right? So the first thing is, like, in this pandemic situation, what we tell the children that first you wear your mask, you sanitize your hands, and then also tell others to sanitize their hand. If someone is not wearing a mask, you tell them to wear a mask. So it's very important to help one's own self first, and also to encourage them to help others in this situation as much as possible for the children. The second thing is, like, we have to make the child to be objective. They should have proper goals, because now, as they are not in the school, we directly connect with the students, so we don't know what is going on in their minds. We cannot actually engage them. We can only engage them in works, but we cannot minutely observe them every time, right? But that was possible when there was the schools were open. So it's very important to promote their social and emotional competency to become objective towards their goals. The third thing is to teach them have positive regards to towards life. That is very important, because, like, what happens in this situation, it's very common that the students become depressed because they are not connected to their friends. They are not they are not going through a usual life that they
Right,
were.
right. We
they
all
were-
are struggling, Dr. Saha, that way, not just the kids, but the elders as well,
Everyone,
adults as well.
everyone.
So
Yeah.
if I come, because we hardly have a few minutes for this SAHYOG session,
okay.
so I would like
Okay.
to
One more point.
bring back Dr. Roy into the conversation. So what do
Okay.
you have to say about this role of parents and teachers in mental health well-being of children?
I think it's a very important question in this pandemic COVID time, because children, schools are closed, as Dr. Lopa has said. Schools are closed and children are sitting at home. They are isolated. They are alone in the family. I mean, they don't have other activities to do. So, in this isolated situation and in this quarantine situation, they face two kind of things. I think one is that they are traumatized by watching TVs and looking at the news. the pathetic news, the death cases, and the fear about this pandemic disease, COVID disease. And so it creates very much fear inside them, and it creates trauma in them. That is one aspect. And then if someone in the family goes positive, becomes positive, and he or she observes the trauma one undergoes by this COVID disease, COVID-19 disease, I think it again creates havoc and fear in children. The second aspect is these days I have seen that the online classes are being conducted by schools and teachers. Now, in most of these online classes, it's a one-way traffic. Teachers only give content, information, and at the same time, the children are overloaded with say homeworks and assignments, and so it creates another tension and anxiety.
Dr. Roy, we
just give me
please
just let me finish.
Carry on.
So what I suggest here is that parents and teachers together they can engage children in some innovative, some creative, some fun activities, some entertaining activities, so that children get engaged in such activities at home, and even they can collaborate, and they can get fun out of it, they can get enjoyment out of it, and they can maintain their good mental health. At the same time, as Dr. Loba was mentioning, we can generate awareness about this health and hygiene, about this this virus, this hand washing and distancing and mask wearing. I think these things can be taught to them so that they can be safe at home also.
Absolutely. So I just have a minute left to conclude today's program. Dr. Saha, I would rush to you. I can see hundreds of viewers are watching us live, and I've got a question for you. There's Vipin Rai watching from Uttar Pradesh, and he says that, Mama, I'm in class 10th, and in this pandemic situation where I have to struggle to study for my board exams, I'm having this stress problem. Can you, I'm sure many of students must be, coming to you for this guidance. Kindly share some tips. We just have hardly 1 minute left. Kindly share some tips for students.
Okay. Actually, I was sharing a overall thing. I told what I say is we have to handle with the stress situation now. For this, we have to maintain proper hygiene. We have to stay active. We have to nurture positivity within ourselves. We have to have healthy diet. We have to have some meaning and purpose in life, and we also have to educate ourselves about stress management. Regarding this, I can also say, if I go to the question of that child, I can say that you can do some exercises, be active, you can do some breathing exercises, you can go for meditation. This will bring in some changes within you, and this will help you to
absolutely. So what I understand is that not just the mental health, the physical health comes with mental health, so it has to be a balance of both. That is what Dr. Saha is telling Vipin Rai, our viewer. And I would like to thank both the guests for joining us today for this SAHYOG session. Thank you very much for joining Kishore Manch today.
Thank you, ma'am. Thank you very much.
And viewers, don't go anywhere, because next we are coming up with Nishtha's discussion. Nishtha module discussion. Please be with us. Thank you.